They said edibles were the safer choice. They told us cannabis was harmless. But now, new research is uncovering a hidden danger lurking in every puff and every bite. And the consequences could be coursing through your bloodstream, even as you listen. What seems like relief on the surface may be a slow-motion assault on one of your body's most vital systems. And the deeper we look, the more complex and concerning the picture becomes. A groundbreaking clinical study has revealed an unsettling truth. Using cannabis, whether by smoking or eating it, may quietly impair your heart's ability to function at its best. This isn't just a temporary change. It's a measurable chronic reduction in vascular performance that over time could open the door to serious cardiovascular disease. These aren't speculative risks. They're biological warning signs unfolding beneath the surface. And while millions turn to cannabis for help sleeping, coping with anxiety, or easing pain, few realize that the very compound they trust might be silently working against their heart. This isn't theory, it's quantifiable biology, and it's time we start paying attention. The heart, after all, is a silent organ until it fails. In a landmark study published on May 28, 2025, in JAMA Cardiology, researchers at the University of California, San Francisco, UCSF, set out to test a prevailing myth that cannabis, especially in edible form, is a benign substance when it comes to cardiovascular health. The investigation was led by Dr. Layla Mohammadi, who specializes in vascular biology, and Dr. Matthew Springer, a veteran cardiovascular researcher with a deep background in studying the effects of inhaled substances on arterial function. The study recruited 55 healthy adults between the ages of 21 and 45. None used tobacco, none vaped, none had regular second-hand exposure to smoke. This was a carefully designed experiment aimed at isolating the vascular effects of only cannabis, specifically long-term use. Participants were split into 3 distinct groups: chronic cannabis smokers, chronic edible users, and a control group with no cannabis exposure at all. Smokers reported an average of 10 years of regular use. Edible users typically averaged 5, but consumed THC in comparable amounts, just in different delivery formats. To ensure fairness and reliability, the researchers also controlled for sleep, diet, alcohol intake, and physical activity levels. They wanted to eliminate as many outside variables as possible to isolate the effects of THC alone. Researchers relied on flow-mediated dilation, FMD testing, a non-invasive method used to gauge how well blood vessels dilate after increased blood flow. Think of it as a stress test for your arteries. If they can't flex and expand properly, your risk for heart attacks and strokes rises sharply. Importantly, none of the participants were intoxicated at the time of testing. This study was about long-term baseline damage, not short-term impairment. This made the results all the more significant. They were capturing chronic biological change, not temporary fluctuation. The findings were not just statistically significant, they were dramatic and troubling. Cannabis smokers had a 42% reduction in vascular function compared to non-users. But edible users, many of whom thought they were taking the healthier route, showed an even worse outcome: a 56% reduction in the ability of arteries to expand. Dr. Mohammadi put it bluntly. We expected combustion to play the bigger role, but the data shows that THC itself has a profound effect on vascular health. She added that even without smoke, the molecule interacts with receptors in blood vessels, creating subtle but damaging long-term effects. It was this unexpected impact on vascular tone and endothelial function that set the study apart. To dig deeper, the researchers collected blood serum from participants and applied it to human endothelial cells, the delicate, essential lining inside blood vessels. The serum from smokers caused inflammation and cellular stress. It disrupted nitric oxide signaling, which is key for controlling blood pressure and blood flow. Surprisingly, Serum from edible users didn't cause as much damage in the cell cultures, suggesting that smoking cannabis compounds the problem, adding combustion-related toxins on top of THC's own effects. Still, both groups had significantly impaired vascular function, showing that even without smoke, THC can independently harm heart health. Dr. Springer added, "This idea that cannabis is somehow natural and therefore harmless needs to be re-evaluated. Arsenic is natural too." He explained that the endocannabinoid system, which helps regulate mood and inflammation, can be thrown off balance with heavy THC exposure. This imbalance might have downstream effects on cardiovascular health that science is only beginning to understand. The researchers controlled for everything they could: age, sex, weight, cholesterol, blood sugar. Even when accounting for all these factors, the results held. It wasn't just lifestyle, it was the cannabis. And not just cannabis use, but cannabis dependence, frequency and dose. This study couldn't come at a more pivotal time. Cannabis use is more widespread than ever, and so is the belief that it's a safe, risk-free alternative to alcohol or tobacco. But popular belief is not always backed by science, and science is now starting to speak more clearly. As of 2025, 41 US states have legalized medical cannabis, and nearly half the country allows recreational use. Daily use of cannabis now exceeds daily use of alcohol in the United States, with 17.7 million regular users. That's nearly 1 in 14 adults. And among seniors, those most vulnerable to heart disease, use is rising at record pace. Cannabis use in people aged 65 and older rose by nearly 46% in just 2 years. The problem isn't just usage, it's messaging. Cannabis products today are sold with health-conscious branding. Labels highlight organic ingredients, vegan formulas, and clean extractions. But few products carry any cardiovascular warning at all, even when research suggests there's a real cause for concern. Without regulation, consumers are left to assume safety where science shows risk. "We're falling into the same pattern we did with tobacco," said Dr. Mohammadi. "Marketing overtakes medical insight. Warnings come too late." This disconnect between commercial image and clinical reality could have profound consequences for public health. And this isn't just about individuals. Public health policies, clinical guidelines, and even insurance assessments may need to catch up with the science. How should physicians counsel patients with heart disease? Should hospitals screen for cannabis use before surgery? Should cardiac rehab programs consider cannabis cessation? These are questions with life or death consequences, and right now, many are unprepared to answer them. The cannabis story is more complex than we've been told. Yes, it has therapeutic value. Yes, it may ease suffering, but it is not biologically neutral. We now have strong, peer-reviewed evidence that THC, even when consumed through edibles, can impair the function of your blood vessels. And for a society already facing an epidemic of cardiovascular disease, this is a warning we can't afford to ignore. So whether you use cannabis or know someone who does, don't let outdated assumptions shape your decisions. Stay informed, stay curious, and stay subscribed. Because science doesn't stand still, and neither should you.